Hello everyone. In today's show, we will talk about plastic surgeries with our special guest, the plastic surgeon specialist, Dr. Luciano from Kind Care Medical Center. Hello, Dr. Luciano.
Good afternoon.
Okay, doctor. Now as a start, could you tell us a little bit about yourself?
I am Dr. Luciano Lanfranchi. I was born in Buenos Aires, but I am Italian. I live in Milano, and I studied in Buenos Aires, Italy, and also in France and Luxembourg.
Okay, doctor. How long you've been here in Dubai, and where did you study? Tell us a little more about yourself.
As I told you, it's 14 years that I do this work, this kind of job. I studied in Milano, I studied in Buenos Aires, I studied in France and Luxembourg, and it's almost a year that I am here in Dubai.
Okay, Dr. Luciano, now as a specialist plastic surgeon, could you tell us a little more about the plastic surgeries that you do?
Well, I do both cosmetic and reconstructive surgery, such as from rhinoplasties, blepharoplasties, facelifting, and then abdominoplasties, breast surgery, and also post-oncologic ones, for example, huge reconstructions after big demolitions, for example, too.
So you do both simple and complicated surgeries?
Yes, of course. Sometimes both of them together, because you can combine both cosmetic with the functional. Mm-hmm. For example, when you do a rhinoplasty, you also have to look after, to take care of how the patient breathes. So sometimes you need to do both functional and cosmetic one, just talking about that, or abdominoplasty if there are hernias to correct, or big diastasis and everything. So that's a big deal, because you have to deal with both of them.
So both will be done at the same time?
Yes, for sure.
Talking about abdominoplasty, doctor, we've heard that you have done abdominoplasty to one of your patients. So could you tell us a little bit more?
Yes, that was what I would say an extreme not makeover, but yes, more or less. But it was a very complicated case, because it was a post-bariatric patient. That means that he had underwent a general surgery procedure to reduce the volume of his stomach in this case, and he had lost 100 kilograms. So as you can imagine, when you lose this quantity, this amount of kilograms in a very fast way, in a few months, you have lots of skin excess and fat excess that you have to deal with, which can create, in certain cases, for example, problems with deambulation or intertreatment, local cutaneous infections, and that's it. So in that case, it's both, let's say, cosmetic, but above all, I would say functional, because once they undergo this kind of procedure, it really changes. It changed their lives, the way they move and everything. So yes, that was a big and nice experience. Very complicated, because this patient was visited by several colleagues worldwide, I would say, with several proposals. And I think in the end we could find the right balance, and I'm very happy because there was an excellent outcome, and I'm really happy about this. But big challenge, I would say it was.
Okay, doctor. And if I asked you, why this patient chose Dr. Luciano specifically?
It would be, I don't know, because of my experience. It's very important when you meet your patient. You have to be very clear with this. You have to be, I am very graphic. I like to draw, to explain very well what will happen. It's important to talk about the risks, the benefits, and above all, I would say the limits of each procedures, so as not to cause false expectations. You have to be very accurate, and in those cases when there is risk, sometimes the patient's life could be risky, because they have lots of negative factors that could affect them and could stimulate, the arising of complications. So you have to be very careful in explaining what will happen, what can happen. And the pre-op visit is fundamental. That's why it's very important that the patient is, well, let's say studied from 360 degrees, from, I don't know, the cardiologist, the general, the GP, and the vascular surgeon, for example, so as to prepare and reduce to the minimum the risks. That's and work above all with safety, which is the most important thing in these, let's say, pseudo-elective treatments.
Could you tell us a little more about this surgery that you've done to one of your patients, which was a very complicated surgery?
Talking about abdominoplasty, first of all, there are several grades of in this case, skin ptosis. Three basically things have to be taken into account, which are: the first one, skin excess; the second one, fat excess; and the third one, very important, which is the conditions of the deeper part of the abdominal wall. That means if there are hernias, if there are muscle diastasis and everything, but above all, the clinical conditions of the patient. That's why it's very important to study very well the patient before any procedure, because for example, if the patient has undergone, for example, other type of surgeries, or if he or she has some scars like cesarean or other general surgery procedures, they are very important to be evaluated before each surgery.
Dr. Luciano, could you tell us what are the standards that you will be looking at while accepting a patient to do such a procedure?
The main aim, as I always tell, obesity is a big problem. I always tell my patients that I am not an arrival, but I want to stimulate something on them. I mean, some kind of departure. I'd like to stimulate them and to change the way they look at themselves, the way they eat, the way they take care of their bodies with exercise and everything. They have to be healthy, because generally they arrive that they are not that good, So, but if after the surgery I find out that they are, that they really change, for me is the best success, I would say, because that means that I changed something on them, and they will keep on improving after my surgery.
Of course. And doctor, how long does it take until the results start showing on a patient after doing the procedure?
Generally, when I remove a huge quantity of skin and fat tissue, the patient will practically feel lighter almost immediately. But the main standard, when the procedure reaches the best result, they have to wait for a couple of months. After that, they can improve it by, as I told you before, eating well, the correct diet, the correct exercise, but always protecting the deeper part of my surgery. When I do wall reconstruction, that means taking care and not doing. I'm talking about exercise and gym and so on. It has to be progressive. It doesn't have to be. Immediately. It has to be progressive, little by little.
Doctor, now, as we said before, this is a very complicated procedure, okay? Such patients who undergone such procedures, can they do any complicated procedures, not related to obesity, but later on, or it's not possible, or it needs more time?
In these cases, you start, let's say, a way together with a pathway together with the patient. That means sometimes, abdominoplasty is not the only problem. Sometimes they have a laxity in the thighs, arms. Maybe they have to undergo breast reduction, which causes, in that cases, for example, can cause, it's a functional procedure because of the pain in the back and everything, and skin infections also can happen with the breast. So they can, after the surgery, they can undergo other procedures. Or sometimes, if the patient's conditions are optimal, they can be done together. Why not?
Okay, doctor. Now, after all the procedures that you have done in your experience, I want to ask you, doctor, when you see your patient satisfied, happy, how this reflects on you?
That's the best part of my work. I really love that. It's something that's why I love this work. I mean, I could do nothing else than a plastic surgeon. So whenever I find this, I mean, good result, patient that is really happy, and that's it for me. It really fills me, and it charges me. I don't know how to explain to you. I'm really, really, really happy about that, and it's the main aim why I do this work. I mean, generally, when you do functional surgery too, and you obtain a very good result, I mean, it fills you. I know it's a good sensation.
Doctor, tell us more about your achievements in plastic surgeries.
Well, it is, it's very important for me sometimes when I combine both cosmetic and functional surgeries. Let's talk by, for example, a simple blepharoplasty. You can have also an eyelid position which is not symmetrical. In that case, you will correct also the eye ptosis. So I do the both cosmetic and functional. The same as for the nose, functional and cosmetic. For the abdominoplasty, when you correct a big problem like a hernia or something like that, and you improve the movement of the patient, for example. And I mean, there are many. Sometimes when you do also a cosmetic procedure that someone could say, but it's only a cosmetic procedure. But sometimes you can change someone's life, because from the social point of view, psychological one is so important. And sometimes I realize that once it is done. I mean, generally, for example, when you find your patient that is well satisfied, and you meet him or her after the surgery, for the visit, for the controls, to take the photographs and everything, you find out how important it was for him or for her to improve something that sometimes is very little. I mean, just, I don't know, correcting an ear, an eyelid, a nose, a profile, and that's it. So you realize afterwards, but that's fantastic.
We can say that it's reshaping in a beautiful way.
Yes. Sometimes as I told you, sometimes it is functional pure, sometimes it is cosmetic and functional, and sometimes it is cosmetic, but in the end it's also functional, because you will help your patient to improve his relationship. I mean, talking about socially. And so it's very important. I mean, everything has, that's why we are all different one from each other. I mean,
Dr. Luciano, nowadays fashion is connected or related to plastic surgeries. Tell us more about that.
Well, talking about fashion, I mean, I always, let's say, have to fight against beauty obsession, which is really risky, particularly in young models, and people who work in the fashion, with fashion. So it is very important in that case to discourage, unnecessary procedures. Sometimes, and above all, I would say, to let the patient know that they are sometimes surgical procedures that, they are not that they come, they do, once they want something like this, the nose in a style, or talking about breast augmentation, for example, they want big breasts, and then they can change it afterwards. No, because you have to take into account lots of items, lots of characteristics. So it is, I think, the most important thing, how and when to say no. I work a lot in front of the mirror and with photographs. You have to explain. I have to explain the patient if there is something unnecessary. I have to explain them that, what are the limits and what can be done or not, and above all, of course, the risks. So I think that fashion, when I have to, let's say, treat models and people from that, from that world, I would say, from fashion, it is sometimes quite complicated.
As a final advice I would like to give to our viewers, doctor, what would that be?
First of all, I'd like to say to take care of their bodies. And the second thing would be to remember that in plastic surgery, three things are very, very important and have to be respected. That they are harmony, proportions, and above all, safety. That means choosing the right professionals that use the best technologies and the best materials in the best places, clinics, hospital, etc. I would like to have spare parts for the human body, but unfortunately we don't have them. So even if the meeting point between, let's say, a plastic surgeon and an architect, a designer, a musician, could be harmony and proportions, remember that in medicine, rarely 1 + 1 strikes 2, because there are lots of variables. And as I always say, that's why we are all like snowflakes. That means unique and unrepeatable.
Thank you so much, Dr. Luciano, for sharing with us your experience. We thank you.
Thank you.
Dear viewers, thank you for watching us. And again, we thank Dr. Luciano for sharing with us his experience and for the beneficial information that he has given us. Thank you.